When the need to urinate strikes more often than it used to, the prostate gland is often playing a crucial role. In this video we outline a quite simple yet effective nutrient-based approach. But first. Hey there, this is Bob and Brian. If you appreciate what we do, please take a look in the description of this video on how you can support us financially. Thank you. So prostate enlargement is a common problem for many men. One of its main symptoms is the need to urinate more frequently, both day and night. But this condition, long term, not only threatens the quality of sleep, it can also reduce sexual function.
So this is called benign prostatic hyperplasia, otherwise known as enlarged prostate.
We are told from the medical establishment that it's just this bad hormone, DHT, that needs to be shut down and treated with pharmaceutical toxins. But is DHT really the true cause here, Brian?
The DHT is not really the cause, it's more of an effect from the actual cause. What is the actual cause? Well, as it turns out, a prostate enlargement does not occur without something called a varicocele. What is a varicocele? It is sort of like a spongy vascular protrusion.
Okay, and in plain English, what is a varicocele and why is its presence worrying?
So, a varicocele is basically a twisted, swollen varicose vein found in the scrotum. And the swelling can cause the blood to backflow into the prostate gland. Now, as a result of that backflow, it can actually elevate the conversion of testosterone into dihydrotestosterone, and that causes sort of an amplification of the cells, and that's why the prostate actually gets bigger. And in turn, that can put pressure on your bladder and cause you to go to the bathroom frequently at night.
So how do we know if we have a varicocele and not something else?
So you can test this. In other words, if going to the bathroom a lot isn't enough evidence for you that you have an enlarged prostate gland, well, we can actually use some testing. So what kind of testing are we talking about? Well, there's something known as inspection or palpation. If that's not enough, there's a method for detecting a varicocele. There's also using Doppler sonography or contact thermography. This is a lot more sensitive, and you can also pick up what's called a subclinical varicocele, and it's sensitive enough so you can identify that this is an absolute thing. So you can pretty much disprove or prove that this is something you need to address.
Okay, thanks, Brian. But how do we correct this? What is the fix here?
Okay, so that is really the big question. So how do we do this? Actually, a couple of different things we can do. There's really 3 different treatment options. There's a classical surgery, or there's the easier way, which is nutritional alternatives.
So what would you do first?
I would absolutely. Yeah, I think most people would consider surgery to be a risky thing, right? So what are those natural options? Well, let's see, they would be things like vitamin K2, otherwise known as minoquinone, and an extract from citrus rinds known as hesperidin extract.
Okay, interesting. And how does vitamin K2 factor in?
So varicose veins have been found to have very high levels of undercarboxylated MGP. That suggests a vitamin K2 deficiency. See, without enough vitamin K2, your veins can become stiff, they can be calcified, they can be inflexible. So supplementing with vitamin K2 can prove very beneficial for not only having to eventually reverse the varicocele, but in turn improve your enlarged prostate.
So basically vitamin K2 supports the integrity of the vascular wall, giving it strength and elasticity.
Bob, you're 100% on top of it. Exactly.
You briefly mentioned hesperidin. How does that help?
There's a substance called diosmin, and this is the ingredient that contains something extracted from citrus rinds, which is the ingredient I was mentioning called hesperidin. And that has been used to lessen the symptoms of chronic venous insufficiency. Think of chronic venous insufficiency as a way to support the vascular wall, the strength of the vascular wall, basically. So over time, especially taken with vitamin K2, you can expect a gradual improvement in your prostate symptoms.
Okay, Brian, that sounds awesome, but how much should be taken?
All right, Bob. So with respect to vitamin K2, a therapeutic dosage would be 180 micrograms. And I'm giving you just a roundabout figure based on what has been examined and what doses people have taken. As far as hesperidin extract, 500 milligrams is a reasonable dose. And that's per day.
All right. And can these nutrients be obtained from food sources?
Okay, so in terms of hesperidin extract, that's a little bit more difficult because that's eating citrus rinds, and there's not really any proper substitutes for this. So you're better off taking the supplement. As far as vitamin K2, there are food sources, but these are very difficult to eat foods. So for example, natto, that's a Japanese delicacy. A lot of people don't like the taste of this. It's an acquired taste. Then you've got aged cheeses, fermented cheeses. The larger the age or the fermentation, the more likely it has K2. So Gouda cheese, Jarlsberg, Brie, those are cheeses with quite a bit of K2. Then you get down to grass-fed butter and organ meats. Things like that have a lot of K2 in it. Outside of that, you're probably looking at supplementing.
And what about fermented butter, oil, ghee, and so on?
Yes, as a matter of fact, probably the most cost-effective option as far as vitamin K2 in food form would be grass-fed ghee, and fermented butter would be a bit more expensive.
Okay, great info, Brian. Thanks. Now when we got that out of the way, I would like to ask you, why would someone develop bad veins or be prone to a varicocele in the first place?
A lot of conditions that lead to producing a varicocele in the first place, a lot of people just say, well, it's developed through age. And yes, we do develop poor vascular tone as we age. But if you're getting things like high blood pressure, you're overweight, having diabetes, poor blood sugar, high fasting insulin, low good cholesterol, in other words, high density lipoprotein, low levels of that, you'd be basically at higher risk.
And if surgery turns out to be the last resort, what type of surgery is this?
Okay, so if you want to go under the knife, then the surgery involved, it's called embolization of the internal spermatic vein. And really it's simply called vascular embolization.
So can you describe this process?
Vascular embolization involves shrinking the large vein by using an embolizing agent, so that substance can clot or close off the bleeding vessel simply by injecting the syringe of that substance, via X-ray guidance.
Okay, so how effective is this surgery, and are there any side effects?
Yeah, so the surgery does have a failure rate in one study of about 13%. But it's relatively free of any serious complications, and there's a possibility, a rather small one, of a reoccurrence. But other than that, it's a relatively safe procedure.
And this will actually heal the issue and getting back to function?
Yeah, so really what's going on is when you got the spongy protrusion of a vein, basically out of your testes, you're creating an actual backflow of the blood. Now, normally that blood is supposed to go, it's supposed to circulate everywhere. Instead, that blood is getting trapped literally in your prostate. That testosterone is in the blood, and it's going to not only affect your libido, it's going to affect your prostate and the frequency that you're going to the bathroom. So this is a situation that could not only improve your testosterone level on a circulatory, on a full body level of circulation. It's also probably going to improve your libido. It's also going to improve your prostate size, and therefore going to the bathroom less time, especially at night.
And perhaps the nutritional approach is the most viable option in the beginning of the disease.
Exactly. In fact, I would say maybe in a more advanced state, maybe the surgery is your best bet, because who really knows how long nutritional therapy is going to take. So I think as a preventative measure, and maybe at a very mild level of prostate problems, this is an excellent idea. And surgery may be more of something in a more serious case.
Okay, Brian, thanks for the info. And to all the listeners out there, please subscribe to our channel and like this video. If you want to support our work for real, click our donate link down in the description. Thank you very much and have a great now.